I'm a spine and joint surgeon. I'm here to tell you something about the new tools which we use for the advanced spine surgery. I'm doing advanced spine surgery in the last 10 years, and definitely you require some tools to make it safe, predictable. We'll have one video to see. So this is a lady, had a backache since 10 years and severe back pain since last 1-2 years, twisted and tilted to one side. She was not able to stand and walk for a few minutes. Stop. So this was the video I operated just before the surgery, the pre-op photographs just before it. And she's tilted here to one side. She's forward bent towards this one, so it's deformed in two planes. There's an anteroposterior graph showing tilted to the one side, and there's a listhesis, the forward bending. So there's a deformed spine in 3 dimensions. If I want to correct that, and there is a compression of the nerve roots, and there is a spinal cord there. If you want to have a safe spine surgery, this was immediate post-op. It has been corrected very well in alignment in both the planes. The spine is corrected well. Now this surgery, 5 hours surgery, and then immediately we wanted to show the patient started walking the same day after 5 hours. This is immediate post-op walking after 5 hours of spine surgery. No neurological deficit, complete recovery in terms of the straightness, and the way she was walking, she was confident without a walker, so she was asked to walk without a walker also. So that's she is walking straight. This is immediately after the surgery. In the morning, surgery of 5 hours, and the post-op in the evening, she is walking without pain. So this is a safe spine surgery after the deformity corrections and like that. So what tools we can use to have such kind of results and outcomes? I am here with a new thing. The bone cutting is required to decompress the spine. And we all know that the spinal roots and spinal cord is very, very sensitive to the touch, removal, axial compressions, and the stretch. We need to do the osteotomy also to correct the spine in both the dimensions, as we had seen in the previous case. Now, to protect the spinal cord and nerve roots, if we have a tool, then that spine surgery is safe, secure, and predictable. The patient has a confidence in you that you can do the job, and then patient gets ready for the surgery. So to make them safe and secure, we require certain conditions for the cutting of the bone. And what are they? Traditional bone cutting tools were Carrison bone punches, which were still accurate. Then there were rotating burrs, there are high-speed burrs, but then that burrs could entangle the soft tissue. That burr can touch the nerve root, and that nerve root can get damaged, and then the whole spine surgery's outcome is jeopardized. So if you want to avoid this, this can cause some dural tear, CSF leak, neurological deficit. And as we know that outside world, patients are not ready for spine surgery. Spine to kholavi જ નથી. Spine ખોલાવા જ નહીં. That kind of attitude is why, because they are fearsome that their nerve, roots, spinal cords can get damaged. And if we can give them something which is safe, secure, and predictable, then they have the things. So the new thing which has come in the last 5 years is the bone cutting tool, that is the ultrasonic bone scalpel. What's that? It cuts the bone with precise accuracy and precision. Why I call it a scalpel? As if cutting the bone with a scalpel. You cannot cut the bone with a scalpel, but we can cut the bone with an ultrasonic scalpel. How it is done, I'll just show you in few minutes. It has greater speed, ease of the use of surgeon, as we can use it as a handle with a pen. It is safe, secure, faster, and hence less operation time. The first video which we saw, I had operated at 4 levels. I have to operate faster. That's how we have to do it with this. The soft tissue sparing. Now this bone cutting tool will not adhere to any soft tissue. It will not entangle any soft tissue, and hence it is safe. As it is cuts with the oscillations, it generates heat and thereby reduces bleeding as well. What is it? How it works? It's a piezoelectric transducer that amplifies the electrical signals, and then they are fed to the machine here, which generates back and forth motion. It cuts the bone with the back and forth motion. It is not a vibratory thing like a saw. It is not a rotatory as a burr. It is back and forth motion. And that back and forth motion is generated at high frequency. And see that frequency, 22,500 strokes in a second. It amounts to 13,50,000 strokes in a minute. And that's how it creates a high energy. And then when touches the bone, that energy is taken by the bone because bone is not elastic, and it cuts. It cuts the bone, but the moment it reaches the soft tissue, as the soft tissue is elastic, that energy dissipates. And as the energy dissipates, that soft tissue is not cut. So that's the beauty of this principle. And that principle has been taken up by the spine surgeons here, by the neurosurgeons in the world. At the bone scalpel, what we wanted since long has come, and has made the spine surgery safe and secure. How it cuts? It's a repetitive impact. This is a bone scalpel. It cuts the bone. It has cut the bone, touches the soft tissue, but the soft tissue is elastic, and hence it is not cutting the soft tissue. So that's it. So it gives a tactile feedback. And when I am cutting the cortex, it's hard. It gives me a tactile feedback. Then I'm cutting the cancellous bone, and then the other part of the cortex, and then immediately there is a give way. So I can cut my lamina without touching the spinal cord. I can touch the facets without touching my roots, and hence all the roots and all the spinal cords can be spared. Lot of patients of fluorosis, lot of patients of cervical myelopathy, dorsal myelopathy, there is a very severe cord. But these patients have hyperrigidity, the cord is survived. What happens? Once we remove the lamina and everything, there is a iatrogenic damage to the cord, and the patient lands in complete paraplegia. Here, we can remove the bone without having any damage to the spinal cord and the roots, and the patient is saved. And we have seen, the moment I have started using this since 2-3 years, my patients have recovered from paraplegia. So that's how it gives us a confidence of using this surgery. Selective to the bone, as I told you, the elastic remains unaffected, and hence it gets in. I can give you a simile, a good video is there. With the bone scalpel, you can cut the outer shell of the egg without disrupting the inner membrane. It's just impossible. You can cut the outer shell of the egg without opening the inner membrane. So that kind of precision is there with this bone scalpel. How it works? Let us have the video. 2 minutes.
The ultrasonically vibrating blade compresses and cleaves cortical bone. The blunt blade advances with ease in the softer cancellous bone. Transition in and out of the cortical layer is easily sensed through tactile feedback. Ultrasonic effects reduce bleeding as the bone is transected. Due to its elasticity, soft tissue is minimally affected during incidental contact with the blade.
The second one, how it works. So this is how the principle of working by oscillations, that back and forth motion, how it works, how it is generated.
The outlet voltage is supplied at 50 to 60 hertz. The bone scalpel console boosts this frequency to 22,500 hertz. The resulting ultrasonic frequency is delivered into the handpiece. Piezo crystals transform the electrical energy into a mechanical vibratory motion. This causes a blunt blade to oscillate longitudinally at the ultrasonic frequency of 22,500 strokes per second. This is the equivalent of 1.35 million strokes per minute. Sterile saline is pumped toward the blade.
This is to prevent the heat. It's a syringe which is
Exits from
giving
a
the
small jet
saline.
nozzle into a channel in the center of the blade. This patented feature directs the fluid into the bone blade interface for cooling, irrigation, and lubricity.
The third one. One demo for the on the sheep model to show how the lamina has been removed.
Okay, so what we're going to demonstrate here is a laminectomy. The settings are 10 on vibration and 70% irrigation. And we're going to start with a small score line, and then we're going to plunge through slowly, piece by piece, and walk
The
ourselves
small
over.
movements
So
to
this
cut
is
the bone.
model here. And let's start up.
Your time is up, Dr.
Yep,
Biren.
we'll just stop this. Stop this, a few seconds.
Score line's done. Just a simple push through.
So that's how we have used it in the spine, and see the beauty. It can be used with a minimal invasive here. The spinal cord is seen here and the bone is cut. The decompression of the spinal cords are all laminectomies, laminectomies, foraminectomies, facetectomies can be used. Minimal invasive spine surgery, the cervical spine, the laminoplasties. Spinal deformity correction, osteotomies, the ponties and everything. Thoracoplasty and revision spine surgery. It has other indications, the orthopedic surgery, plastic reconstructive surgery, neurosurgery, where you have to cut the bones in a precise manner, the thoracic surgery, and general surgery. The limitation is a high cost, more than 30 lakhs, availability.
You are in the S gratia,
Yes.
right?
So, been using it since long. Thank you.